Hi, everybody. Hello. Thank you so much for coming. Welcome to National Public Health Week Student Day. It's nice to see you. I'm Lindsay Wahowiak from APHA. APHA, the American Public Health Association, has been working with American University students to plan the Student Day for and by students. So we are here. We are making some noise, and that's okay. We're glad to have you here to talk about how to find a career once you graduate. Folks will be filing in. They'll be grabbing snacks. Folks are also watching at home live on webcast, so hello. Anyway, we're really glad that you're here. Feel free to ask questions along the way, and the folks at home also ask questions in the chat function of the live feed. We will have somebody here monitoring those, and they'll be asking your questions out loud also, so that's going to be great. Without further ado, I would like to introduce Lindsay Wiley, who is a professor of law and the director of the Health Law and Policy program at AU, and we're very glad to have her and all of our panelists. So thanks for coming.
Welcome, everyone. I'm really happy to be with you this evening, and I was honored to be invited by the student organizers of this event. I'm Lindsay Wiley. I'm a professor of law and director of the Health Law and Policy program here at American University. And in addition to my law degree, I have a public health degree. My focus is on law as a social determinant of health. So in addition to the discussion on the panel, if anybody's interested in talking about combining public health studies with studies at a law school, feel free to come up during the reception or pose a question during the live feed about that. So I want to make sure that I thank, before we move on, I want to make sure that I thank Sophia Samanas, Gabby Kyle, and Lee Sandler for organizing the event. I also want to thank their advisors here at American University and at APHA, including Lindsay Wahowiak and Susan Polan. And of course, I want to thank our stellar panel of early and mid-career public health professionals. So it's my honor to introduce, to my immediate left, Sharon Seda. Next to her, Justin Morgan, and at the end, Leila de Avila. Dr. Seda is an epidemiologist and a senior scientist at the Centers for Disease Control and Prevention in the Division of Diabetes Translation. She's also a commander in the United States Public Health Service. She has a PhD in epidemiology from Johns Hopkins Bloomberg School of Public Health, which is also my alma mater. Justin Morgan is a research analyst at the Urban Institute, where he focuses on the impact of the social determinants of health on historically marginalized communities in the United States. Mr. Morgan finished his bachelor's degree in public health here at American University in 2016. Leila de Avila is a research coordinator and program manager at the Betty and Guy Beatty Center for Integrated Research and Center for Liver Diseases, which is part of the Inova Health System based in Falls Church, Virginia. Ms. de Avila also completed her bachelor's degree here at American University in 2016 in public health. Unfortunately, for those who saw the program earlier, I just want to let you know that our fourth panelist, Jessica Rogers, regrets that she isn't able to join us this evening due to an illness. So I'll be starting us off by asking some questions of our panelists and guiding us through a bit of discussion of your backgrounds, your interest in public health, your current positions, and your advice for students who are sitting here in the room and watching us live as well. To start us off, can you each tell us a little more about your backgrounds and what brought you to public health? Do you?
Oh. I'll start. How's that? We'll just go in order. All right. So I start. So I came to public health kind of by happenstance in some ways. When I was in undergrad, I majored in math and anthropology, which are two fields people really don't think are very much alike, but you can actually find some commonality between those. And what it really drew me in anthropology was like studying cultures, and I was very interested in medical anthropology, kind of studying the culture of health in different areas. After I graduated from college, I had a number of different jobs, kind of trying to figure out what I was going to do, and kind of happened upon epidemiology, right? Studying people and populations and causes of disease. And so I decided at that point to go to graduate school in public health. So I ended up going and getting my PhD in epidemiology.
So I originally, when I got to AU, was doing a pre-med track. I didn't think I actually wanted to be a doctor, but it was one of those things where I thought I might, and if I decided junior year I want to be a doctor and I hadn't taken organic chemistry, it was going to be really hard to figure out what I wanted to do from there. And freshman year, I just picked public health as a major because it had a lot of overlap, obviously, with the pre-med courses. And it took me about 3 months to realize that I was definitely doing public health and definitely not going to be a doctor. I just kind of fell in love with this idea of addressing these real health issues at a population level and trying to address them specifically for communities that are suffering from health disparities really spoke to me on just on a personal level. And I've been doing that ever since, 7 years now.
So I actually came to public health by like a process of elimination. I came to AU as an SIS major, and then I lasted in that for about, I don't know, almost a year. And then from there I went to communications, and I didn't love it. And then I kind of just stumbled upon this intro to public health course as a gen ed. And I couldn't believe I hadn't found public health sooner, because I've always been interested in people. I've always been caring towards people and wanting to help others. So that's kind of what brought me to public health, and I wish I had found it sooner so I had gotten to take a little bit more classes, but I had junior and senior year to actually enjoy the classes. So that's how I came to public health.
Fantastic. So next I'd like to ask you each to say a little more about your current positions, and I might suggest a few themes that would be great to touch on in particular. So, and some of these we've already actually addressed. So thinking particularly about how your current work relates to the population perspective of public health, to the prevention orientation of public health, and not everybody's work necessarily touches on all three, but also the social justice commitment that is very much a part of public health for many of us. Can you tell us a little bit about your portfolio and your current position, how it's evolved, if at all, and what a typical workday is like for you?
Should we mix up how we go so you can
Yeah,
start this
I'll
time?
go first this time.
I have 3 kids, so I'm used to deciding what order people go in.
We'll mix it up. We'll mix it up.
Perfect. So
You need to do the middle one sometimes first.
Yeah.
That's my tip, pro-parenting tip.
the middle kid
goes
always
first
feels kind of
sometimes.
left out sometimes. It's
Yeah.
good to start with them.
Justin can start us off.
So I'll probably answer your question backwards. So a typical day at Urban, for me, and it really differs depending on what kind of research you do. At a policy organization like that, we have quantitative versus qualitative researchers. We have researchers in all sorts of different fields. So I'm in health policy, but there's Metropolitan Policy Center and housing and all sorts of different things. But for a quantitative, more public health, less economic focused research assistant, my day is mostly spent in the data. So that means I've got one or two statistical programming softwares open on multiple screens at my computer, and I'm doing the coding, and it kind of looks like the Matrix or whatever with all the stuff in different colors coming down my screen. But I'm cleaning, analyzing, and doing exploratory analysis on data sets ranging from the smallest local data to big national data sets, trying to tease out the things that make or break health for populations across the United States. And so my current portfolio is actually very diverse compared to what it was 2 years ago. When I started at Urban, I came onto one project that kind of was funding my whole existence at the organization. That was all about maternal and child health and evaluating this Medicaid program for pregnant mothers. And I learned all about maternal and child health, which was not my passion point, but I just became, if not an expert, then somebody well-versed in birth weight and gestational age. And from there, after the wrap-up of that project, I've moved in a bunch of different directions. So I do some work around weathering theory and how economic stress affects health at the population level. We're going to look at commuting zones as kind of our general area of interest. I do work related to how access to public housing affects health for adults and children, maybe just parents and children. We'll see how it goes. Do work related to we're doing actually a community-based research project just started out in Baltimore trying to address hopefully many different facets of what might be interesting to the neighborhood to explore there. We're still at the beginning stages, so we're still in the stages of the community kind of just telling us what they want. But I'm on that project in case they decide to go down a health route, and we can just sort of explore what options they have for doing research in that field. It's actually a lot, and I don't want to take up all the time, but I really could go on forever on a bunch of different things. But we'll just say broadly social determinants of health and health disparities work. And then you had 3 things?
Oh, I think you've touched on them.
Perfect.
Without
Great.
even meaning to. It's just inherent in your work.
Awesome.
That's good.
Prevention, population perspective, social justice commitment.
Okay, yeah, we're set.
You're good. Okay,
Should I go?
Layla.
Okay. So I work at Inova Fairfax Medical Campus, and I work in their research department. So we're really focused on obesity and liver disease and sort of the correlation between the two of them. And mainly we're looking at non-alcoholic fatty liver disease. So you can get liver cancer just by having fat in your liver. You don't have to have any alcohol to get there. And it can kill you. So it's something that we're actually trying to screen the population for to better understand the condition, because 1 in every 4 Americans has the condition, and you can be lean to have it as well. So that's sort of like where we focus as a whole, but we've focused also on like hepatitis C and hepatitis B, other forms of liver disease, but those actually have cures. So this fat in your liver condition doesn't have a cure yet, and we're trying to better understand that. We also enroll people in clinical trials, so people who are, phase 3 and phase 4, so like the last stages of a clinical trial. So I guess that would be like the screening component of your question. Day to day, I'm recruiting people to enter into the study. Usually cold calling people or working on like campaigning and advertising around the hospital. I also do phlebotomy, so I learned how to draw people's blood. So we have a clinic and people come in and I work on that. I kind of like fill in the clinic if people need help. And then I'm working on a program. So we're trying to understand kind of the neurocognitive issues that come along with liver disease, because when your liver decompensates, there's sort of a rise in toxins in your brain, and that's called hepatic encephalopathy. Sorry to get so technical. But it's basically where your brain sort of gets fried, and you lose your memory. It's sort of the stages before you pass away. So we're trying to understand how, someone's memory and their everyday functioning skills, like their attention, their processing speed, how that might be affected if you have a chronic liver condition. And what was the last one? Did I miss anything?
You talked about prevention.
Okay.
Population perspective. Is that an aspect of your work?
Population perspective, yes. I mean, we do look at like big metadata. So we focus, on seeing people day to day, but we also look at big databases that have, like the National Health and Nutrition Examination Survey is one of the resources we use to look at people who have like hepatitis C or hepatitis B. We look at, I think we look at Medicaid and Medicare databases as well to look at insurance coverage for people that have those conditions. So there's a little bit of a population perspective.
Dr. Seda?
All right. So I work at Centers for Disease Control and Prevention. So we are the lead public health agency for the U.S. And I work in the Division of Diabetes Translation. And so I direct our work in the diabetes division. We do a whole variety of work. So we have a lot of the diabetes prevention program, the National Diabetes Prevention Program, where we're really trying to get those programs out into communities and help prevent diabetes throughout the country. My focus itself is really on leading the surveillance efforts for diabetes among youth and young adults. So we know that the obesity levels are increasing in the U.S. just across the spectrum of almost all ages, but particularly among kids and also young adults. And so one of the things we do is we had the question, is diabetes then, especially type 2 diabetes, increasing in the youth population? So if you're not familiar, there are two basic types of diabetes. There's type 1, where your body just stops making insulin, and type 2, where your body makes the insulin, but it doesn't use it properly. And the type 2 tends to be caused by obesity and lack of physical activity. So our surveillance efforts for diabetes among youth is tracking both type 1 and type 2. And so I run that program where we have 5 different clinical sites, and we do a registry to count the number of cases among kids with diabetes. We also have a new study where we're looking at diabetes among young adults, also looking at both type 1 and type 2 to see if the younger adult population is increasing for those conditions also.
Excellent. So I wonder if we can start to talk a little bit about the connection between your educational backgrounds and the work that you're doing now to sort of bridge the gap between the students who are here in the room and the professionals on the panel. Are there aspects or insights or skills that you carried from your educational background into the work that you're doing now? And are they the skills or insights that you expected at the time to be the most important, or are there some that have been a bit unexpected or surprising? And Layla, you get to go first this time. See, I'm good at keeping track and keeping it even.
You are good. Okay, so let me see. So my job is very, you have to be very methodical in research. You know, you have to follow a plan. You have to have an abstract, like a hypothesis, a methods section, a results, and a conclusion. So I would say I am the least methodical person, and I ended up in research. So I would maybe say epidemiology helped me a little bit to just get prepared for looking at big data and having to ask research questions and answer them, and then sort of see if they're generalizable. So I almost wish I had a little bit more of the skill set before going into it. And epidemiology was actually the worst grade I ever got in college, and I ended up doing it. So there are a lot of surprises headed your way.
So I feel like I use my skills every day from graduate school in terms of just epidemiology, biostatistics, everything that I learned in that. But I also feel like from undergrad, I was really prepared to look at questions in lots of different ways, just to have a really broad focus, and writing I find is extremely helpful every day.
Justin?
Yeah, I'll echo what they said. Lots of hard skills. I learned a few different statistical programming languages while I was here at AU, and that really helped to get the job. For one, they wanted somebody who could do the work that they were asking them to do, but also helped my onboarding and making sure that I could just hop right in on projects and take it from there. But then also just different undergraduate experiences outside of the classroom. Internships kind of prepare you for that work life. I worked on campus as a researcher in the sociology department, which kind of got me hip to the research process and what that was going to look like, and also just bred a certain intellectual curiosity that you need if you're going to do research for a living. Mm-hmm. Yeah.
So, Sharon, you have your PhD in epidemiology, and Justin, you let us know right before the panel started that you are returning to school, enrolling at Harvard this fall.
Yeah, so I'll go get my PhD in not epidemiology, but social and behavioral sciences under their population health sciences umbrella, which is really exciting.
So I wonder if you might say a little, and Layla, whether you've considered continuing your education as well, about that decision. I imagine that's something that's very much on the minds of those who are studying public health as undergraduates, whether, sort of what does the job market look for them now, whether at some point they'll return to their studies. And this time it's Sharon first.
Okay, so like I had said, when I was in undergrad, I didn't really even know the field of epidemiology existed for a while. And so for me, I can't imagine, not going to grad school really would not have provided me any opportunities because I didn't know about the field. I think now it's very different in that there's the opportunities in undergrad in public health. When I was in grad school, I did start out in a master's program and decided that I did my master's, and that what I really wanted to do is be able to lead studies more and really direct the research. And so because of that, I went on and got a PhD.
And I kind of took a different tack when I got out of undergrad, or as I was approaching getting out of undergrad, I didn't know 100% if research was going to be the field I want to go to. It can be a bit of a slog sometimes. And so instead of committing to grad school where I'd have to pay somebody to teach me stuff that I may or may not end up ever actually using, if I decided, I'll just go be a social worker, I'd have to go get another grad school degree and then go do that. So as opposed to that, I figured, well, let me just get a job in research and I'll know right away if I could work in research. And then they're paying me to do that as opposed to the other way around. And it worked out, and I fell in love with it, and I know for a fact that I want to do research, and so now I feel like I can go get a PhD, which I will definitely need if I want to move beyond like just past entry level at any research organization. So,
Layla, is it something that you're giving thought to?
Yeah, I'm considering either going to PA school, physician's assistant school, or becoming a clinical social worker. Both clinical, but both very different professions. So that's been on my mind recently. I initially wanted to get my NPH, and then I realized I kind of wanted to be more on like the individual level of care versus population level, which is, I'm doing more of the population level at my job. But so yeah, I mean, I don't have all the prerequisites for PA school, so it's going back and doing the post-bac and then going to PA school, whereas clinical social work, you can sort of jump on in. So that's something I'm considering.
Great, fantastic. So I wonder whether there are things that you understand now about the public health job market. Sort of what's the landscape like? What are the options available that you didn't understand when you were an undergraduate first beginning to study public health that might be helpful to the audience? Choices that you have to make when you're looking at positions to try to find the right fit?
So for me, I think it was my turn, right?
Yeah.
My turn. For me, it was kind of getting a grasp, because just coming in from that kind of data science side, there's a side of it that's academic research, and there's a side of it that's sort of policy and advocacy. And so getting a grip on that and what I wanted to do and where I wanted to be within that. I mean, it's public health, it's a huge kind of monstrous thing that encompasses everything. You're in law, people, you can do whatever you want and still be working in public health. You're in clinical work. I mean, it's just so...
Except maybe like selling cigarettes.
Selling cigarettes
There's
would
some
be
things
very
you can
tough public health.
Actually, I've got a former student who's now working for an e-cigarette company doing harm reduction, so maybe you can even do that.
See, so there you go. You could literally sell cigarettes for public health. And so I think it was just more taking the time to try and, I don't know, it's kind of an inner journey to figure out, okay, this is this huge thing, but how do I find the thing that most makes me spark and go in that direction? I think that was, I mean, I'm lucky I landed in a spot that immediately clicked for me, but I have a couple friends who kind of bounced around between different places doing different kinds of things before they found the work that they were like, okay, I can wake up early, go to this place, get home late, and still be happy. That takes a little bit of time, and it might not be immediate. You just kind of got to bounce around.
Yeah, I don't know if I have good advice with this question, but I would say, I mean, to me, it looks like the job market is open. Public health is so broad, as you just spoke about. There are so many different avenues you can go in or walk down for public health. And I would say it's good. Like, there are a lot of, in my opinion, a lot of research opportunities out there. They always need someone who's organized and can be a coordinator and has good communication skills, which I'm sure you all have great communication skills. And I know they always say, like, we need someone who has 1 to 2 years of experience doing some type of like coordinator role or what have you. But if everybody said that and everybody like stuck to their word on those job posting sites, like nobody would get a job, So someone has to give you a chance outside of school. And I think if you just put your best foot forward and don't get discouraged, you'll find the right first job that you don't have to be in the rest of your life. So I would just put your best foot forward in anything that you find that looks interesting.
You don't have to take your turn if you don't want
Okay,
to.
skip that one because
Fair enough. how can aspiring public health workers set themselves apart in the job market? Is there advice that you have about steps that they can take to develop soft skills? Are there particular hard skills, some that you've mentioned already, that you think would be important to pursue? Or is it something else altogether?
Is it me first?
Yeah, I can do that.
I would say connections will help you a lot, actually, and to not be, don't, throw those out, just give them a chance. If you have any kind of connection, somebody who works at some place that you would love to work at and whatnot. I think that really helped me because through connection, I became a research volunteer as a student at this hospital, and that's how I got hired back. Hired for the first time. So I would say, I don't know, just try and see what interests you, see who you might know within an organization to just at least maybe get an interview. That's all I have for right now.
Yeah, I think I would agree with that advice. Some of it is just, even if you don't know someone in an organization, if there's an organization you hear of that you're really interested in, try and set up informational interviews or try and learn more about it or see if there's a way you can do an internship or volunteer somehow while you're a student is always a good idea. And I think having a combination, being able to show you have a combination of some like harder skills, we could say, analytical skills or strong writing is always important also. Mm-hmm.
Yeah, I have to agree on both fronts, especially the second part. I think skills are going to be huge. If you can do phlebotomy, somebody will hire you somewhere. If you like the people who are hiring you to do a job, and if you can do that job demonstrably, then
That's always better.
yeah, it's always better. There are places that'll definitely take a flyer on you if you show that passion and have that commitment, and they're like, we'll train you. You're just going to be a great person to have here. But if you can't translate that in an interview, even if you do or don't have it, it's always good to be able to say, well, I can actually just do the job that you're hiring for, and we'll work out the rest later. So hard skills, I think, are incredibly important. The soft skills are also huge. Interviewing well, making sure you make good connections is another huge thing. I'd say rely on your professors and just generally other people you've met in fields to kind of help you make those connections. If you look at you go to a place you want to work and you go to their website and you look down and you see all these names and faces that you don't recognize, start asking around to see if anybody does know somebody, because people who can put you in touch, you just want to have people out there who can be sponsors for you and help try and guide you to the right people, or at least make that connection, and then you can take somebody out for coffee and go from there. But connections, they said it. I don't know why I'm still talking.
Yes,
Yeah,
please.
so I'd add one thing to that, and that is really taking initiative, because even, any employer you go to, if you can show that you'll take initiative and you're not going to be the employee where they have to hold your hand the whole step of the way, that will get you pretty far along.
Yeah, I want to dig a little more deeply into how to build these connections and really in concrete advice for students about what to do when you ask for that informational interview, when you take someone to coffee. There have been some interesting think pieces floating around, circulating on social media over the last month or so with advice about, don't just, I think there was one that was by, somebody who's an expert who gets contacted all the time, and it said, don't just invite me out to coffee, have a plan, share with me what some of your skills are. How do you do that? It can be hard for some students if they're more shy. How do you convey the hard skills that you have in those kinds of interactions? How do you engage the person who you're seeking advice from or seeking connections from? Do you have any advice about that, other than just it's really hard, isn't it?
So I would say that if you think about it as if you're going to go and formally interview someone. So if you come up with like a set of specific questions you want that person to address or answer, it'll make it easier as opposed to just, hello, my name is whatever, and this is what I'm interested in. If you have maybe even like, this is where I want to end up in my career, how do you think, what are some steps I need to do to get to that place? Or what did you do to get to where you are? But I think coming in with really concrete questions or ideas that you want to address helps.
As opposed to just sort of
Just,
expecting
I want to go to
the
coffee with
person
you
to
and
take the
let's
lead.
chat.
Yeah.
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 I feel like I could talk forever on this.
I think students would really appreciate any advice that you have, so don't hold back.
So probably the first thing is to actually have a good sense of who you are. That doesn't have to be a finished product, but really understand, well, why do I want to talk to this person? What about me makes me interested in what this person does, so that you can be engaging? I think a lot of people don't think critically about what their actual story is before they get to a place, and so then they can't convey it when asked. All right, you sit down with the person for coffee, and they're like, tell me about yourself, and you came with a bunch of questions for them.
Right.
And you can't really, relate yourself well or sell yourself. I think another thing is just a networking relationship is like literally any other relationship, and it really hurts people's feelings if you don't follow up. If you ghost somebody, it hurts. Please don't reach out to somebody, go out for coffee, get to know them, and then don't tell them where you end up if you decide to go somewhere else, or don't, stay in contact. That's going to burn a bridge. And then when you do finally want to maybe get back to them or be like, oh my God, there's an event at this organization, I'd love to be able to grab a ticket to it. I know somebody there, but actually I know I actually can't because I burnt that bridge. And I actually had that happen to a friend of mine who reached out to somebody at an organization. They got back to them, but they took a job somewhere else and just didn't respond to their email. And when they needed to, when they were interested in switching, that person just told them straight up, don't contact me. You really need to just treat human beings like human beings. The person at the other end of that phone call, the person at the other end of that email address is a person, and they want to be treated as such. That said, people are, at least in research, people are very excited about the work they do. They take it personally. And so if you email them and say, I'm very interested in the work you do, it makes us feel good. And we'll probably come talk to you. I actually got into Urban because I cold called the director of the center and said, I'm just really interested in the work that you do. And she called me back, and I was shocked. But I'm not so shocked about that anymore because you get to know people, and when you actually have research, it's like your baby, and somebody's like, your baby's cute. It's like, great. I'd love to.
They want to talk about their cute babies.
Yeah, so I think it's just like building any other relationship. You really have to take the time to get to know somebody. Take time to let somebody get to know you, because maybe it's not just about that one person and what they could do for you, but you've now made a friend, we'll call it, or a sponsor, you could say, who they know your story, right? If you can relate your story well, there's somebody out there in the world who knows your story, and when they hear about a job that you might never have heard about, you're like, oh, you know what? I think Layla would be an amazing fit for this job. But if you didn't go out there and you couldn't relate your story well, then that won't happen. So.
I think that's excellent advice about treating it like any other relationship. I would just add, as someone who gets a fair number of those kinds of requests, really be respectful of your potential sponsor, potential mentor's time, too, because the more you view somebody as being in a position to potentially help you with your career, the more likely it is that they're getting a lot of those kind of contacts because everybody's been to career panels like this, where they say, ask people out to informational interviews, get in touch with folks. Just make sure that you acknowledge in your communication with that person that what you're asking is significant, and that you're respecting their time, and that you're available on their schedule as much as possible, that sort of thing.
One last thing, and then I promise I'm done, is this is something that a mentor told me, and he'd be very, very upset if I didn't share this, but these are two-way relationships, and you can't be somebody who just sucks resources out of somebody else and expect them to continue to work with you.
Don't be a mentee vampire.
Yeah, exactly. If you see a link to something and you think, oh wow, this is just what that person talked about when they talked to me, or I think this person would be really interested, send it to them. Be somebody who helps. That builds a relationship where they could be like, not only is this person somebody I view as a mentee, but they also linked me with somebody else. They introduced me to somebody else. We have a thing going here. As opposed to you only ever hit them up when you need something, which again, just like every other relationship in your life, is very toxic and is just not sustainable, and people are not going to respond well.
I feel like you just covered all the bases.
So, yeah, go ahead.
I just have one point. Like, I would say just to touch on what both of them have shared, like establish your board of directors or people that can vouch for you. You guys are still in school and you all probably have another month left or 2 months left. Right? You're all seniors? No? Okay, sorry. You've got time. This is great. This is great. Okay. So just find your teachers who you really respect and who you think understand you maybe, or you've gotten to know on a personal level, and follow up with them and get coffee with them and share yourself and your interests with them, because those are going to be the people that are most likely going to vouch for you when the time comes. And it's always good to work on building those relationships.
Excellent. So I want to wrap up this part of the program before we open it up to student questions and audience questions as well as online. I want to wrap up with some bigger picture questions about the future of public health and what the field is likely to look like over the course of the career of somebody who's currently an undergraduate. What are some of the challenges that you see looming on the horizon that are going to face the next generation of public health workers? How do you manage your optimism about your work with perhaps sometimes feeling disenchanted or disheartened about your work? And do you have any advice for the sort of protecting your own wellness and mental health while doing this kind of work, particularly working on things like health disparities or situations where individuals can be facing very dire health concerns?
Where are we?
Where are you?
I'm
Okay,
self-governed
I'll
at
go
this
with
point.
I think that's a really difficult question to think about. If you think about like just the landscape of public health itself, there's, you can go in so many different directions, especially with health disparities. There are more and more, we're more aware of health disparities in some ways, although at the same time we've been talking about it for years and we still have not made enough progress on it. So I think that will continue. I know when I finished my degree, there was the thought that there will be no more, like infectious diseases are kind of on the way out. We're only going to be concerned about chronic diseases. And I think that's probably definitely not true anymore. We're seeing more and more resurgence of infectious diseases. And so I think just there's both infectious and chronic, and then really understanding mental health and how all of this plays a role together. So I think that's like kind of the big picture of public health. I think it's wide open. There's a lot to be done in the area. In terms of the kind of public health workforce, I really see it changing in that it used to be, like when I finished, you really had to have a graduate degree in order to do work in public health. It was kind of expected that if you were in public health, you had at least a master's degree in the field. And now it is more open there's lots of opportunities for undergraduates, and there's just a lot more work being done, which I think is great. There's like a much bigger public health workforce than we've had before, and I see a lot more opportunity.
Fantastic.
I kind of see it as public health is this huge, broad thing, and so it's the same things that are going to be big in public health are just the things that are going to be big for life and the world generally. So climate change is going to be huge, right? When you think about, mental health is going to be huge as it's become an issue that people are, paying a lot more attention to. When you think about health disparities, all those things that we think that you just go through in your daily life are going to be the things that people are going to have to care about in public health. It all kind of ties into it. How do I get through the day?
This is my Barbara Walters moment.
Oh, amazing. I'm going to try and do it justice. I mean, you kind of have to be optimistic about the kids, right? Everyone kind of pawns it off on the next generation. I'm not old enough to do that yet, so I kind of have to be optimistic about like my friends. But that, we're getting smarter and we're getting more aware of what's going on, and we just kind of have to take it and run with it, and see where. I mean, you just kind of. I don't know. You wake up in the morning, you just think today will be better than yesterday, and if not, it can't be that much worse than yesterday, and maybe next week will be good. So like you just kind of have to perk up and go for it, and then if not, definitely take care of yourself and get a therapist, or walk outside in the sun. All those different things. There's the new Japanese tree therapy you could do, right? Go to the woods, all sorts of things. So,
I would say it's exciting what's coming down the pike. I mean, especially for technology in public health. At least like at my hospital, like we are working with this artificial intelligence group who's starting to be able to read liver biopsies. It might be a little sad for, the pathologists. It might take some of their jobs, but it's supposed to help. It's supposed to make it better because there's such a variability between one person reading a biopsy and the other person. They could get two completely different results. So within medicine, I think it's really exciting, like artificial intelligence and like simulation. I just took a tour in this simulation lab at Inova, and there are robots giving babies. There are like all these control rooms who are basically controlling these people. I mean, they push them around in wheelchairs. I mean, it's really strange, but it's supposed to help people. It's supposed to help residents get better at practicing medicine before being thrown in. I think one issue maybe might be burnout, and you kind of touched on that a little bit for public health workers and just healthcare providers in general. I know it's a big problem. I think we're going to be losing like 45,000 physicians, I think, in the next few years just because of burnout. And this sort of emotional fatigue when there are so many public health issues to focus on and so many things you care about. So I don't know, if you're like me, I tend to shut off all of my news alerts and just focus on one source that I respect and I actually like to read about because it's completely overwhelming. I like to follow a couple different issues that I care about just to not get overwhelmed. I would say, take care of yourself. Work-life balance is important, and you should share that with the next generation too.
Excellent. So on that note, we'll open it up for your questions, including questions from those who are watching remotely, which can be submitted in the live feed?
Yes.
Yes, and will be read aloud by one of our student organizers.
Hi, I'm Dana. I'm a freshman. How and where do you think we can make connections as public health students at like an undergraduate level?
Well, something I wanted to comment on your previous comment, Justin, was sometimes it's good to just if you idolize someone or if there's an organization that you love the mission or you actually maybe not want to work for, but you have kept your eye on them a little bit, I would just randomly reach out to somebody, not with the intention to get a job with them, but to build a connection. Because people can see through that. If you have the intention of getting a job with them and you're just there to get a job and, have them get to know you, I think that can bleed through sometimes. But if you go in without the intention of that, with just to make a connection and to tell someone you appreciate their work or the work that they do and the organization's mission, and if you have some type of connection to the work that they do, I think that would be helpful.
I would definitely reiterate the things that just go talk to your professors. They are all your professors because they actually know something about public health, which means they know somebody in public health if they're not currently still doing it. And so they're your best bet, within the immediate 500-yard radius of yourself. But besides that, definitely just reach out to organizations. You're a student and the world is at your feet. People want to hear from you. They want to give you a shot. There are you're in DC for everyone who's in the room, which means that there are just a bunch of national organizations that need interns, want interns, might not pay you, but definitely give you their time of day, and then you can meet people through that. But the cold call never hurts.
Yeah, so I would, I think that's right. Talking to your professors is really helpful, looking at organizations around here, but also clearly reach out to your alumni. I mean, it seems like from the panel here that the alumni also from AU or whatever school, if people are at other schools, is also another resource for you, and they're good to, they've gone through what you've gone through. and are probably a really good resource.
I think also, and we touched on this a bit, but events, especially here in the DC area, but really in any city that might be nearby, and don't just go to the event as a student. Don't just plan to show up and assume like, oh, it'll work out, I'll meet some people there, and this is one of those things that my professors told me to do. Combine these things, right? So look at the list of speakers. See if any of them might be alumni of your school. Ask a faculty member who might be going to the event, whether they might be able to introduce you to some of their contacts. But all of that works much better if you can let your professors get to know you and what your interests are, tell them your story. As a faculty member here at AU, I think it's amazing how rarely a student comes to me and really tells me what they see themselves doing, what they're interested in, why they're here. You know, they tend to sort of ask us lots of questions, but I'm able to help students much more effectively if I have a sense for what they're interested in. So that if I know a student's coming to a conference and I'll be there as well, and I also know sort of what that student's interested in, I might be able to look at the agenda and say, oh, I know these 3 people who, you know, Dana, come to the event, find me during the cocktail reception, and I'm going to try to connect you with these 3 people who have a particular connection to your interest, right? Not just, you know, random people I might know, but where there's some intentionality on both sides. Yeah. Any other questions from the audience?
Hi, I'm Julia. I'm a sophomore. I am just wondering if any of you have any words of wisdom on how to work your personal narrative on why you wanted to get into public health, what led you to it. How do you use that to sort of bring attention to yourself to employers? Because I'm someone who, the reason I got into the reason I became interested in public health is because of a personal health issue and my connection to that. And I'm wondering if you have any advice on how to use that to your advantage with employers, how to add that personal touch with that story.
Well, I would say part of it is kind of what Justin was saying, really tell your story and be honest about it. And have like a reason. You might have a personal health reason that led you to it, but clearly there's more than just your personal health reason why you're interested in public health. And so really make that connection for the employer. Yeah.
Yeah, I think if you can find a connection between your personal health history, or it might be a family health issue, which it is in my case, that drew me to public health. If you can make a connection between that and what about public health you're pursuing, you know, so that it's not just, oh, health broadly defined, right? Mm-hmm. That's a more compelling explanation. It also helps somebody think of you as, okay, this is somebody who's interested in tobacco control because, and this is my story, 3 of my 4 grandparents died of tobacco-related illness before they were 70 years old, right? And so if I tell somebody that when I'm a student and I say I'm really interested in tobacco control, I'm really interested in my case, how law plays a role in tobacco control, that's a very memorable connection, right? So tying things together, connecting the threads.
So when I was a sophomore, I couldn't do this. I think it's just taking time to be able to do it for yourself before you think about trying to do it for an employer, or you're interviewing for an internship, or you want to get into a conference or something like that, and you're trying to get a scholarship or anything like that. I think you really have to think through the story on your own. Why exactly do I want to do this? Really question it. There's an exercise that the Career Center at AU made me do when I was applying for a scholarship program, just called a stream of consciousness essay, and they said, okay, just tell us everything about yourself as best you can in like 1,500 words, and just write. And we don't care about grammar or where you put your commas, periods, whatever, just write for 1,500 words about how you got to this point in your life. And it was really helpful for me because my brain just started making connections about things that I hadn't thought about critically before. So I recommend that, just to see where you land. And I think once it clicks for you, it's easier to tell others. And you won't feel like you have to frame it a certain way. It'll just be your story.
Mm-hmm. That's good advice. I wish I knew that. I would say and even recording yourself doing that too, because I find when I write, I'm so hyper conscious about getting the grammar right that I lose sight of anything I'm trying to say. And writing's just always been challenging for me to have that stream of consciousness. as I would in comparison to like just talking out loud. So maybe like recording yourself, or try doing that too. And it's also important to realize that like everyone is still writing their narrative, you know, and like I'm still writing mine for sure. And I stumbled upon public health, which makes me maybe a little bit different than other people who had a reason why they joined public health. So sometimes I'm self-conscious about that, you know, that I wasn't as intentional about joining public health as I was, but it doesn't make me any different once we're in the workforce and doing what we're passionate about, you know. So everyone has a different process or way of getting there. And it's important to share those things with people that you feel comfortable with in an interview. You know, if you don't find that it's the right moment to share why you joined public health, or more of like the personal parts of your narrative, then you don't have to share it. But I don't think it's bad to, you know, I think it's a good thing.
Hi, my name is Brandon. This is a question for Justin. So you mentioned that you used a lot of the statistical programs. When did you like learn it in undergrad?
Oh, yes. Okay. So for the AU students, you can go to, I think they might have moved buildings since I was here. When I was here, I think they were in Hearst. But
He's going to give you literal directions.
Yeah.
Where you can learn.
But just look up CTRL. But they will teach you Stata, SAS, R. R I would highly recommend, because it's free and open source, and you don't need a, like at Urban, they pay for my Stata. I would not be able to afford Stata on my own. But I mean, and this probably goes for everyone at every university. Your university is full of resources that you've already paid for with your tuition, which may be exorbitant. So don't walk out of there discounting them. Make sure you grab everything that you can. That's free. And one of the free things is usually free classes. And even if it's not statistical programming, there's somebody at your school teaches an Excel class for free. Somebody teaches a GRE class for free that you've already paid for. Like, oh, it's not free. You've already paid for it. So go get it. For the AU students, there are people in this room who could probably help you find it. But for everyone else, you just go get that. Go to your school's website and figure out where it is. But all those things are definitely accessible. And if not, just start taking statistics courses or whatever it is at your university where you might come across those things. And I mean, that's for statistical programming, but this really applies broadly to anything you might be doing. Yeah.
I think we have time for maybe one more question. Oh.
Okay, so this is from someone online. You guys talked about earlier about your soft skills and your hard skills that you have. This question is, what skills of those do you think are the most important to emphasize at a job interview? And how can students gain these skills before they enter the job force?
So I think some of that depends on what job you're interviewing for. I mean, if you're interviewing for a job that is wanting you to help analyze data sets, then it would be important to emphasize that you have that skill, right? If you're interviewing for jobs where you're going out and doing a health survey, where you're going out and talking to people, maybe that's more important to really emphasize how your interpersonal communication skills. So some of it is really just kind of looking at what job you're applying for, and then emphasize those skills so clearly you're the one that they want to hire.
Yeah, same. It's really going to come down to what job you're going for. And like I was saying before, while you're just look up what the resources are at your university. I wish I knew all the resources at every university to actually help this person. But they're somewhere. They're there. That inflated tuition you're paying covers this somewhere, and you'll be able to find it.
I would say active listening is really important in an interview, and not just sort of like jumping from question to question or answer to answer, just trying to like pull in everything and be able to like synthesize what you guys are talking about or what you're getting at, because then that just plays into so much of your everyday work life. Are you a team player? Even like if you're a statistician, like you're still working with a team, right? Or even if you can do like a very technical job, you're still working with people, unless you're working on like a drone up above us, or, you're like just completely isolated. I would say active listening is really important.
It's an excellent note to end on. Please join me in thanking our excellent panelists. And for those who are on site, I'm sure our panelists are happy to stay and answer your questions and meet you. And if you have questions about law school, feel free to talk to me as well. Thank you so much.